In less than 2 weeks, the FDA could authorize Pfizer's COVID-19 vaccine for children 5 to 11 years old. And right now, Georgia's public health department is working with pediatricians to bring them up to speed on offering this vaccine. Joe Henke talked with 2 pediatricians this afternoon to learn what they're hearing from parents and how they're preparing. Joe.
Sheba, so far in the pandemic, the trusty trio of hand washing, mask wearing, and social distancing is what pediatricians have been able to recommend for 5 to 11-year-olds. The doctors I talk with say now the vast majority of parents they see want to have their children vaccinated as soon as possible.
I'm sure we'll have all the same concerns that we see on our kids 12 and up and adults from various families.
Dr. Hugo Skornick of Conyers Pediatrics is president of the Georgia chapter of the Academy of Pediatrics. He anticipates families will bring up more specific questions or hesitancies if the vaccine is approved. But right now, the only question he is hearing repeatedly is when will the vaccine be available?
Could be, the beginning of November when we have this vaccine available.
I'm really seeing widespread, enthusiasm for the vaccine. And the kids that I see, they cannot wait to get the vaccine either, because they're the last ones in their families to get them now.
Dr. Jennifer Hsu with Children's Medical Group's Decatur office says for her too, the only common question is when will the shot be available? Currently, her office is working to make sure they can handle high interest in the vaccine if it is approved by the FDA later this month.
We've been giving a lot of flu vaccine to kind of get that out of the way and get those appointments done and free up some space for kids who want the COVID vaccine.
Skornick is interested to see the final data and research Pfizer presents to the FDA, but he expects to offer the vaccine at his practice and recommend it to families with younger children.
If it's like the other vaccines, why wouldn't you want your child protected against this virus?
If the vaccine is approved and available late fall to early winter, Hsu says the timing could be perfect.
As I am concerned about winter holidays coming up. And so if the kids can get fully vaccinated before then, as many children as possible, I think that will help with family celebrations over the winter.
And while Dr. Hsu there says she has mostly heard from people that would have had their child vaccinated months ago if possible, she does have a response for any vaccine hesitant families she talks with. That message coming up at 6.